When should you see a lactation consultant? If you're a first-time parent, I'm going to recommend that you ask for lactation at the hospital and then follow up with an appointment in the clinic. So what can happen even if breastfeeding is going well at the hospital is that things can change so drastically, or even just coming home and having a different environment can make it so all of a sudden breastfeeding isn't working. And so really important to have that follow-up, as well as it's a nice assurance. So your milk is in, you come into lactation, we weigh you before feeding and after feeding. We weigh the baby and we can actually tell you how much baby is getting. We can tell you, at this point your baby is getting this much and is gaining weight accordingly. And so really important to make that follow-up and follow through with lactation. If you're having pain, nipple pain, breast pain, any of those things, damage to your nipples, you're having cracked or bleeding nipples, I want you to see lactation in the hospital and afterwards as well. Nipple pain that's lasting for more than 2 weeks. So there will be some discomfort with breastfeeding because you're not used to that whole process. But if it's lasting for more than 2 weeks and you're having pinching pain, I want you to see a lactation consultant. If you're given a nipple shield or you start using a nipple shield for any reason, I want you to follow up as well. And as well as if you're having issues with your supply, you have questions about pumping, you have engorgement or a clogged duct, we can help you through that process as well. And then if you're wanting to exclusively breastfeed, so you have a situation where you're having to give bottles or baby's not satisfied after the breast, and you want to have a more exclusive breastfeeding time with your baby, come to lactation. When you see lactation, you should feel that they are hearing you and that you're listened to, that you're respected, that they understand your lifestyle. A lot of times we have these goals for you and we want you, to do X, Y, Z, and this is how you get here. But if it's not practical advice and if it's not practical to your lifestyle, you're not going to follow through with it. And so you need to find someone that is going to partner with you, that understands your lifestyle and really gives you practical advice during this time. The end goal of breastfeeding should be happy mother and a fed baby.